This medication, Ropinirole ER, is used to treat Parkinson's disease. It can help improve movement abilities, reduce shakiness, stiffness, slowed movement, and unsteadiness. It may also lessen the number of times when you can't move. Ropinirole ER works by restoring the balance of a natural substance called dopamine in the brain. It can be taken alone or with other medications. The daily dosage and optimal timing for taking this medication will depend on your individual condition, so it's important to follow your doctor's instructions carefully. Before starting to take Ropinirole, make sure to read the patient information leaflet from your pharmacist. Always take the medication as directed by your doctor, usually once daily, with or without food. Swallow the tablets whole and do not crush or chew them. The dosage will be based on your medical condition and response to treatment, so your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. Take the medication at the same time each day to get the most benefit from it. If you stop taking the medication for several days, you may need to slowly increase your dose back to your previous dosage. Do not stop taking this medication without consulting your doctor. If you suddenly stop using this medication, you may experience withdrawal symptoms such as anxiety, depression, confusion, fever, and muscle stiffness. Your doctor may lower your dose slowly to help prevent withdrawal. If your condition does not improve or gets worse, be sure to inform your doctor. Some common side effects of Ropinirole ER include nausea, vomiting, drowsiness, dizziness, abdominal pain, or headache. If these side effects persist or worsen, it's important to inform your doctor. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential side effects. Many people taking this medication do not experience serious side effects. You may experience a sudden drop in blood pressure, leading to dizziness, nausea, or fainting, especially when starting the medication, increasing your dose, or getting up suddenly. To reduce this risk, be sure to get up slowly from a sitting or lying position. Ropinirole ER may also raise your blood pressure, so it's important to monitor it regularly and inform your doctor if it becomes high. Contact your doctor immediately if you experience any serious side effects, such as new or worsening uncontrolled movements, changes in mental or mood, or unusual strong urges. Some people taking Ropinirole ER have reported suddenly falling asleep during their usual daily activities, even without feeling drowsy beforehand. If you experience increased sleepiness or fall asleep during the day, avoid driving or participating in other potentially dangerous activities until you have spoken to your doctor. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other unusual effects. Before taking Ropinirole ER, it's important to let your doctor know if you have any allergies or if you are allergic to this medication. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Also, be sure to inform your doctor about your medical history, especially if you have heart disease, high or low blood pressure, sleep disorders, mental/mood disorder, or liver problems. Ropinirole ER may cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. It's important not to drive, use machinery, or do anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, it's important to talk to your doctor about it. Before undergoing any surgery, be sure to inform your doctor or dentist about all the medications and products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this medication, especially mental/mood changes, nausea, and vomiting. For pregnant women, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It is also unknown if this medication passes into breast milk, so it's important to consult with your doctor before breastfeeding. Remember to follow your doctor's instructions carefully and ask if you have any concerns about taking Ropinirole ER. It's important to be aware of any potential drug interactions with Ropinirole ER. Certain medications, such as metoclopramide, as well as substances like alcohol, marijuana, and opioid pain relievers, can affect how Ropinirole ER works. Other medications, including cimetidine, fluvoxamine, and omeprazole, can also impact the removal of ropinirole from your body. Additionally, smoking can decrease the effectiveness of Ropinirole ER, so it's essential to inform your doctor if you smoke or have recently quit. Always consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medications while taking Ropinirole ER. If someone has taken too much Ropinirole ER and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. This medication is used to treat symptoms of Parkinson's disease, such as stiffness, tremors, muscle spasms, and poor muscle control. It is also used to treat restless leg syndrome. The usual dose is once a day, 1 to 3 hours before bedtime. Follow your doctor's instructions carefully. If you forget to take a dose of Ropinirole ER, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store Ropinirole ER at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When you no longer need the medication or it has expired, it's important to properly dispose of it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.